With
when
no
it
need
says
to
stay at home,
change
that
your
means stay at
normal
home.
purchasing patterns.
You know, that's
What I mean
stupid.
is, do not take this direction as a
Yep.
reason to run to the
Christine-
stores, buy everything in
Christine's
sight,
kids
and
is here in
hoard
Rockford.
vital supplies. Please, the grocery
Yep.
stores will remain open and stocked. So
All
be
right.
mindful of your neighbors and do
All
not hoard supplies. Hospitals will continue to treat patients. The city's essential services will not cease. The CTA will run. Airports will be open, and your garbage will be collected. And yes, you can still go outside for a walk, but practice social distancing. Remember, this is the new normal for now. I think and I hope people recognize and understand that these decisions are being made for the long-term health of everybody, everywhere in our entire state. Let me remind you that some helpful resources that you can access to stay informed during this crisis. For Chicago, the best and most up-to-date information is the public health website, chicago.gov/coronavirus. And if you'd like to get text alerts, text COVID-19, that's COVID 19 to 78015. That's COVID-19 to 78015. And every day at 11 a.m., Monday through Sunday, Dr. Already's daily conversation session is being held. The doctor is in, and is carried on Facebook Live. I also want to announce, in light of this order, we will be closing fully Chicago parks and libraries for the duration of this order. Some of these facilities may be repurposed to help support some other essential services by third parties, but effective tomorrow at 5 p.m., all city parks and libraries will be closed. This is a make or break moment for our city and our state. Never in our lifetime has our own health been so intertwined with the health of every single person with whom we interact. Neighbors, coworkers, loved ones, frontline workers. Please realize your responsibility to them and continue to take care of yourself. Now, as I said recently, while this is a period of physical isolation, we should remain in contact with our families, friends, and neighbors. Please call and check in with seniors, people who are vulnerable. We have disrupted normal social networks and interactions, but it is critically important that we not lose our sense of community.
Saturday,
This is not a time for every man for himself. This is a time for every man, woman, and child to be united together. The choices we make today can renew and restore health and prosperity in Chicago and throughout Illinois. It is time to do more to flatten the curve and build our pathway to the other side. I have faith in Chicago's resolve and resiliency to help us get there. Thank you very much. Gentlemen.
Thank you, Mayor, very much for your remarks. And ladies and gentlemen, I have over time been relying upon experts both here in Illinois and across the nation. The research that they've done, the work that they've done has guided me in many of the decisions that I have made. I thought it would be important to have one of those experts here today that's outside of our Department of Public Health, who has some very important guidance and background on why this order is so important. And so I've asked the lead epidemiologist at University of Chicago Medicine to join us here today, Dr. Emily Landon.
Good afternoon, everyone. First of all, I want to send my sincere gratitude and support to all of the healthcare workers in Illinois and around the world. Despite doing our best to prepare for a respiratory virus pandemic, we now find ourselves facing a brand new virus with too little information, not enough personal protective equipment, changing protocols every single day, and no second chances. The University of Chicago Medicine and every other hospital in the state has been and is working very closely with our public health departments. Without these partnerships with each other and with public health and the CDC, we could not have made it this far, and we will not get much further. And so I also express my gratitude to everyone working in public health. All of us in the field of infectious diseases and the public health community are united in our efforts and agree with this course of action. I've spoken with many of my colleagues across the city and the state, and we all acknowledge that this is the only way forward. This virus is unforgiving. It spreads before you even know you've caught it. And it tricks you into believing that it's nothing more than a little influenza. For many of us, it may not be much more than the flu. And so it can be very confusing as to why schools are closed, restaurants are shuttered, and now the virus is taking what's left of our precious liberty. But the real problem is not the 80% who will get over this in a week. It's the 20% of patients, the older, those that are immunocompromised, those that have other medical problems, who are going to need a bit more support, some oxygen, or maybe a ventilator, life support. We do amazing things like this to save patients in our American hospitals and across the world every single day, but we can't take care of everyone at once. And we can't keep that low mortality promise if we can't provide the support that our patients need. Our healthcare system doesn't have any slack. There are no empty wards waiting for patients or nurses waiting in the wings. We barely even have enough masks for the nurses that we have. Looking back to the last time we were limited tools and having a dangerous infection spread quickly was the beginning of the 1918 pandemic. 2 cities in America made different choices about how to proceed, and when only a few patients were affected. St. Louis shut itself down and sheltered in place. But Philadelphia went ahead with a huge parade to celebrate those going off to war. A week later, Philadelphia hospitals were overrun and thousands were dead, many more than in St. Louis. This is a cautionary tale for our time. Things are already tough in Illinois hospitals, including mine. There's no vaccine or readily available antiviral to help stem the tide. All we have to slow the spread is distance, social distance. And if we let every single patient with this infection infect 3 more people, and then each of them infect 2 or 3 more people,
well, that's what they're trying to make.
There won't be a hospital bed when my mother can't breathe very well, or when yours is coughing too much.
But you put a shutdown, why should you be?
So in my house, we've made a lot of sacrifices. We don't go out anymore. This is the first time I've left my house in some days because I'm leading our efforts and emergency planning from my home.
Yeah. Like I told my husband, he needs.
My son has traded in sports, a science conference, and the 5th grade bake sale for puzzles, e-learning, and some video chats.
Take a chance of going out.
This isn't the life any of us expected, and certainly there are others who will make much greater sacrifices. And there are many more disappointments to come. But this isn't going to be forever, like the governor said. It will last longer than any of us want it to. But in the end, we will look back and see it as just a piece of what happened in our whole lives. And we have to remember that.
Yeah.
How can soccer or book club be so dangerous?
Yeah.
Why ask so much of people for just a few hundred cases? Because it's the only way to save those lives. And now is the time. Because the numbers you see today in the news are the people that got sick a week ago.
Is it?
And there are still people today who got sick today who haven't even noticed that they've been sick yet. They picked up the virus, and it will take a week to see that show in our numbers.
Okay.
Waiting for hospitals to be overwhelmed will lead